Hi, I'm here with Megan Leslie, the health critic for the New Democrats, and we're just at the Station House Coffee House and Gallery talking to seniors about healthcare. We're going to be doing that throughout the day. We have a lot of meetings going on, but Megan, how's Brantford been so far?
Oh my gosh, it's been such a warm welcome already. The skies are blue, the temperature's perfect, the coffee was good, so it's a great way to kick off. And we had a lovely conversation over a cup, which was the perfect way to start the day.
So basically, this is the Local Ideas Listening Tour. It's something that we've been doing for several months, where we bring people in to find out the ideas that are happening locally. Because I really truly think that we have ideas locally that can actually help the rest of the country. So it's going to be pretty open. I'd like to introduce our guest, the NDP health critic, Megan Leslie.
Wow, I'm so amazed with the turnout. This is really spectacular. So Jack Layton, our leader, asked if I would serve as the health critic for the NDP, which is really exciting for me. So, well, my background's law. So what does that mean for the fate of the healthcare system? Well, you know, my lens that I look at health through a lens. We all have a lens, right? My lens is poverty. My lens is the social determinants of health. What are the things that determine whether or not you're healthy? Very likely, if you're a senior, you have poorer health. Very likely, if you're poor, you have poorer health. Very likely, if you live rurally, you have poorer health. There's certain indicators, certain social determinants that could show what your health is likely to be like. So that's really important, I think, as a lens to look at health. So we all know Tommy Douglas, right? And Tommy Douglas did an incredible thing. He had an idea, he had a vision for Medicare. You go to see a doctor, you go to the hospital, and it's free. But you know what? That was phase one for him. That wasn't supposed to be the end of it. But the problem is, we have been so busy protecting that piece because it's been under attack, right? There's a lot of money to be made off the fact that we're sick. There is a lot of money to be made off the fact that we might be sick. I mean, just look at the United States. We have been so busy protecting phase one that we have never touched phase two of Tommy Douglas's vision. And phase two was, well, how do we prevent people from going in the hospital? Phase two was a national pharmacare plan, universal pharmacare coverage for Canadians. Phase two was home care, people having the dignity to be able to stay in their homes if they're sick, but have appropriate care. Phase two was long-term care. Phase two was health prevention, making sure people have access to nutritious foods, making sure they have access to mental health programs. Phase two was health promotion. We haven't gotten there. So Jack has said, Megan, I want you to learn as much as you can about all these different areas, and then I want you to get to work and start drafting legislation for some of these really important areas. What would a national pharmacare system look like for Canada? Draft it. Right? We need this legislation. It's not just about ideas and talking and wouldn't it be nice if. Draft it. Draft long-term care legislation. And by long-term care, that should include home care. It should include community-based care. It should include residential care. Stop talking about it. Draft it.
I want to say also, I believe it's really important to do this now. Part of the reason is we have 4 years before we have to renegotiate the Canada Health Accord.
Yeah.
That's the agreement between the provinces and the federal government about how healthcare funding works. We need to start doing that homework now and not just, oh, we'll put it off, we'll put it off, we'll put it off. It's not going to be the same as it was this time. It was a 10-year pact this time. We really need to start doing that work now, and all the parties, not just ours, need to start doing that.
So what does community have to say? What is your experience of healthcare in your community? How can we improve it? If you had the chance to envision healthcare in Canada, what would you do?
So who'd like to start? We'll do maybe 3 at a time to start.
Okay, first of all, I live in a seniors apartment building, and what I have found is your home care has been cut so drastically. The people aren't getting the help they need. There are terminally ill people that are only getting an hour a day and they need more than that. And the help's not there anymore. They need.
That's one thing that's concerned me when somebody said about all the, I think, healthcare. That some of them have homemakers coming in and stuff like that. But they're not allowed to administrate the pills. Some of them needs the help, like the inhalers. They have to be shaken. They can't even shake them for the poor seniors.
And the reason being is because we're an unregulated healthcare provider, okay? So we don't have a regulating body. We don't have a college of nurses. We don't have something that governs the personal support workers. Now, we've started it, so keep your fingers crossed. It's not government, I guess, recognized as of yet. It's PSW's doing it for all of you. But that is one of the things we are looking at, because a lot of them are not trained in medications. So would you want someone who does not really know the difference between Ventolin versus a steroid versus, you wouldn't want them giving you your medication?
I would like to encourage you at the federal level to recognize and appreciate the importance of wellness in healthcare, in connecting people to the services that they need, and allowing them the dignity and the opportunity to be able to get to wherever it is that they want to go in our community the same way that able-bodied persons can. And persons who have a range of disabilities and seniors should not find themselves always placed on the bottom of the heap in terms of importance. They should be acknowledged in the same light.
As far as a plan of on a federal level, about an hour up the road from here in Waterloo, there's a wonderful complex called Luther Village, and what it is, it's staged housing for seniors, and it offers from condos to apartments to semi-care to full-time care to palliative care, and it's all in one area. I would like to see a federal plan that it's mandatory, that it's paid for by the government, so that health care is available to all seniors, whether you have money or not.
Seniors is supposed to be at golden years and turning out to be bloody torture.
I'm really glad that you raised this today and that Megan's here. It's nice to have the ear of more than one of our representatives in Ottawa. Thanks for coming. I don't have any answers, but I've been on. I was the chair of the health unit. I was on the CCAC board before this government took that apart. You look at some of the crazy things that happen. And I think back to, and before I forget, Dorothy, when Dorothy was here from Operation Lift, one of the things that really piles money on the municipality is the government plan to have folks stay at home and receive health care in the home, but there's no funding for transport to get them out to their appointments, right? So that's on the backs of the municipal taxpayers. One of the many anomalies that we've got in the health system in Ontario, right? When I was at CCAC, we would always get announcements on a Friday afternoon. So there came a Friday afternoon when we got an announcement that we were getting $55,000 to be able to fund the physiotherapy for hip replacements, right? But you'd expect concurrent with that there would be funding for hip replacements. There was no funding for hip replacements, so we didn't do any hip replacements. None of the money got spent, so they were able to re-announce that amount of money, I guess, a month later in another community. Right. It's just way too politically driven. The same year we got a check in the mail for $80,000 to renovate our offices, which had been renovated the year before. So, we sent it back, I think. Health unit, we get scarce funding there, but rather than top up the base funding, we would often get an announcement that would come from the provincial government with some dog and pony show intended to be passed on to the consumers of healthcare here, but no money for the basics. So I guess maybe the whole thing has to be depoliticized somehow. Good luck.
And there's a couple other members of council and other folks from the public who are involved in creating a council on aging. One of the subgroups from that council on aging is a group looking specifically at transportation issues. And one of the things we've identified
Council on
was...
Aging, sorry, locally or provincially?
Yeah, locally. It's a local
Awesome.
council on aging.
Great.
We also have actually, through the, at the city council, we have a task force on making an age-friendly community. I want to follow up on the question of transportation. Dorothy identified that sometimes there's not the dollars associated with transportation. It's one of those strings you mentioned. If you're going to have a string attached to something,
Yeah.
a string you're going to want to follow is that if there's program funding or health-related funding, that you build into that the transportation component. No new program funding unless there's a way in which you can make sure that people can get to the program to receive the benefit of it. Because otherwise, like you say, you're just externalizing the cost to the municipal taxpayer, and then I don't think that's fair to us, it's not fair to the municipality, certainly not fair to seniors.
Or the individual.
Or the individual, that's right. Because basically, as Dan pointed out, what you're doing is you're creating a false sense that there's something that's available to them that's really not there. The other piece is retrofitting houses so that people can live at home.
I'll keep my response quick because this is great. It really is. Bill 304 for this Housing Act actually says, think about supportive housing. So people could stay in their homes but also receive the kind of treatment or the kind of care that they need. Think about mixed housing. It's not just about this big block where you're like, that's where the poor people live. Or that's where the seniors live. Can't it be integrated? Can't there be home ownership and rental and supportive and barrier-free? So that's exactly what we're talking about. When we started talking about things like physio, the Canada Health Act says that your health care services should be free. And if they're not, it's actually a violation of the Canada Health Act. Where was physio? Where did you used to get physio? You used to get it in the hospital. And how much did you pay for it? Nothing. Where is it now? It's in a private clinic. And do you pay for it? Yes. That's privatization of our public healthcare system. And somehow we just sort of fell asleep and we don't worry about it. It's like, oh, well, that's normal. We should have to go to a physio somewhere else and pay for it.
About it.
Yes.
But
not nationally.
We can't, like, if it's outpriced for us, we don't do it.
Yeah, we were talking earlier about the Canada Health Act, the Accord coming up for renewal and renegotiation. We need stronger rules about this privatization. This is exactly what's happening. We're taking key health services and privatizing them, and people are making money. It should be free for you. So we need a stronger health accord in 2014. With the transportation issue, I will say that's something I have not been hearing. So this is new, and I recognize it. I recognize it in my own community, but this is new for people to start talking about transportation with me. So that's really great. I've got it flagged. I'm going to do some work on that. And as far as depoliticizing, Dan stepped out. I think you can depoliticize, and I think it's by having strategies, right? You don't let the municipality do a little bit here and a little bit there. You don't let the province do a little bit here, or the feds. You have a housing strategy. You have a pharmacare strategy, and it takes some of the politics out. So all is not lost.
We're talking about senior-specific healthcare also. One of the things I did most of my studies on, actually, was on senior-specific services. So the idea of a senior-specific agency to help prevent emotional, physical, and financial abuse of seniors. There is a great need, especially as we have this bubble, the seniors bubble that's coming, to have these senior-specific services, because if we want to have strategies, we have to be able to target things. That should be one of the things we should be targeting in our healthcare, is senior-specific issues, and also, to be quite frank, Aboriginal health issues, because that's that's one of the largest growing birth rates in this country is the Aboriginal birth rate. So these are two populations that have very specific issues that we should be targeting specifically to save us money, to increase healthcare, and to increase access and equity with healthcare. We just finished talking to a room of mainly seniors, but a lot of other people about healthcare, their concerns. How do you think it went?
Oh my gosh, it was fabulous. It was fabulous. I mean, this is the Local Ideas Listening Tour. There was so much to listen to. I've got this book full of notes. I'll send you the transcript. Really incredible ideas from community. People, you can tell they're very engaged in what's going on. One brilliant thing, someone said, seniors, they're afraid to speak out. And I don't know what you're doing in Brantford, but they're not afraid to speak out here. It was excellent.
No, it's good, and that's exactly what we were looking for with all of our initiatives, really, is getting people out, getting their opinions, getting their ideas, and having a culture of politics locally that is open to that.
Yeah.
And we think we're on our way.
Yep. Hey, it's democracy.
Exactly. Now we're off to another meeting, because it's been a long day and it's going to continue to be one. Good day, though. But Megan, I'd like to thank you for coming, and I know the people of Brant do too.
Thank you. It's really been my pleasure.
Thanks.